Are you looking for the right doctor for your hair transplant? Well, stick around because I'm about to introduce the newest hair transplant mentor doctor. Right, like I said, in this video I'm going to be introducing the newest doctor to be joining hairtransplantmentor.com, and I'll just go and tell you, it's Dr. Sean Behnam in Los Angeles, California. So with that said, let's jump into the results. All right, starting off with this older Korean gentleman. 2,045 grafts were used in one procedure using FUE. You can see the hairline mapped out. You can see the space that Dr. Behnam is considering for the actual surgical plan of attack. And what I like about Dr. Behnam is he's a big believer in video, and here we are with video of the result. If you go to his website and you go to his YouTube channel, you will see this result. I wanted to include this because I thought it was such a great representation of age-appropriate hairlines and the fact that they can still look dense, they can still be fairly aggressive in placement. Part of that has to do with the approach that needs to be taken with a lot of Asian patients because hairlines are different between Asians and Caucasians usually, and this is a case that really exemplifies Dr. Behnam's approach to naturalness and density. You're going to see this theme throughout this video, but also with the videos that he publishes on his own. He's always talking about naturalness because that is his #1 priority. I like that priority, and I think it obviously worked out well for this patient. Single hairs in the front, nice density behind it for a fantastic final result. Next up, we got another Caucasian patient, more advanced hair loss. Dr. Sean classified him as a 6. This series of before images was taken way back in 2014, so it's basically 10 years ago, and he had 7,100 grafts via FUE for the result that you see now. And what I like about this is, again, more video of the result, and we're able to see all the angles of the final outcome. And finally, we're able to see the donor area on one of these patients where, with a normal haircut, it looks like he has a full head of hair. There's nothing standing out that he's had, to indicate that he's had surgery whatsoever. Natural hairline, natural singles in the front, great coverage on the top, and the donor area looks completely normal as if nothing has ever happened. So love these results. And just a quick note, this guy's name is Steve, and you can meet him yourself if you do wind up going to the clinic because he is Dr. Behnam's patient coordinator. This patient came in for FUE, and the total number of grafts was 5,100 grafts, and this is one of those cases where he's actually recording the before scenario before the surgery, and you can see the clear outline of where the hairline is going to be placed, but you can also see the area of loss. About a Norwood 4A on the Norwood hair loss scale, and that requires a pretty aggressive approach. 5,100 grafts, you'll see, was an appropriate number. We got the mapping out of the donor area. You can see the line going down the occipital region of the scalp, and this is dividing the donor area into day 1 and day 2. 2,500 grafts, give or take, on day 1 for one side, and then on the other side there will be another 2,500 or so grafts extracted. He does only perform one surgery a day, one patient a day, and that's what this patient gets to benefit from. So you can see Dr. Sean is doing the extractions, fantastic magnification looking at the grafts. Here we got one of the trays set up where you can see the implanter pinned, you can see grafts in their storage solution. Here's the placement after the end of the day, and you can see that there's really high density in that recipient area. I assume that this is after day 2. Only 7 months later, we have this result, and it's only going to get better. The hair is still very immature, but you got great length on it. So that's a testament to the quality of the work that was done. And you see the density that Dr. Sean is really proud to show off. 5,100 grafts. There's no gaps, there's no thin patches. It looks like it's really good growth in that frontal zone. And there's nothing negative to be said about this. We go through some different angles here. You can see the difference before and after. Again, 7 months, 5,100 grafts via FUE. Then we're going to swing around the back, and Dr. Sean's going to comb through the donor area to show what that looks like. Really nice to see this. It looks untouched. Good density in the donor area. No signs of surgery, not even the white dots that you would normally see even with great FUE surgeries, which can still leave some white dot scarring. We don't see that in these shots. fantastic outcome. Again, only 7 months with 5,100 grafts. So patient has a lot more improvement to look forward to. So yeah, what can I say? Great job. Next up, we have a Caucasian male in his 20s, 2,400 FUE placed into the temples and behind the forelock. One thing that Dr. Sean wanted me to note was that the hairline design that's drawn out was not the final design that they went with. You look at the result here, and you can see that it's actually more aggressive, and this was adjusted during the surgery based on the patient's wishes. Dr. Sean thought it was appropriate, and so they went for it, and that's why the graft count was up to 2,400 grafts, which is a fairly good number, especially if you want to achieve density. And I'm going to stop the video here to point out that before the surgery, you can see the frontal forelock was fairly dense, but then after surgery, I think this is 1 year after surgery, you can see that the density blends really nicely into the areas where grafts were placed. And what this tells you is that it's a high density placement, and without the gaps or the patches of poor growth, you can see that it was very successful, a very high yield, so that the density of the transplant blends nicely into the density of that native forelock. You look at the temples, a nice curvature, it's not too sharp, which helps to lend itself towards a more youthful and juvenile hairline, but it still doesn't compromise the future as the patient gets older. Looks really good, looks really natural. Single hair grafts, doesn't get better than this. Fantastic. Next up, we got a crown repair, and what I like about this photo with the outline that's actually drawn onto the crown is you can see he's actually labeled with arrows the direction of growth for those native hairs. So on the right-hand side, on the right whorl, you have hairs moving off in this direction, and then off over here towards the center. Down in the left whorl, it's actually going up the side as well and coming back into the center as well. Very nice outline, and then the result of 2,550 grafts via FUE. 1 year later, there is zero evidence that surgery was performed, but you can also see that the flow of hair direction is extremely natural, and there is no way that anyone would ever suspect that this is a surgical result or that he even lost hair to begin with. It's very nice coverage. 2,500 grafts is a lot of hair for a crown like this. I think it's a perfect number for this case because it's just enough coverage and density to where it looks like he hasn't lost any hair, and it's not so much hair that's going to deplete his donor area for future work should he want some for the front or for the mid-scalp if he ever loses that. And what I like about this profile image is you can see that the crown is not flat from a lack of fullness. There's enough density, there's enough coverage to where there's still a curvature on the back of his scalp from his profile, because when you look at guys that are losing their hair, from their profile, the crown area actually looks flat, or it can look flat if not enough hair was placed in that area. So that's a great outcome on multiple angles for this patient. Well done. Next up, we have another Asian patient, 1,870 grafts, again via FUE, only 7.5 months after his surgery. We got, the placement was into the corners where the hairline is higher than that previous temple procedure that we saw, 2,400 grafts on the Caucasian patient. This hairline is a bit higher, 1,870 grafts. 7.5 months later, Dr. Sean recorded the video of the result. Obviously, the patient lives locally or somewhat locally, so he can come in for the follow-up. But as he's combing through this, I want you to look at the density. I want you to look at the naturalness. The part line that he's creating here reveals the density of the placement, because that's the tell. If it doesn't look like it's a naturally dense part line, then the density is obviously not as high as you want it to be, at least in cases like this. But what's great about this is you can see the naturalness with those single hairs in the front, and he continues to comb to show the density on this. I love these kinds of results. And we get to see the frontal hairline in that corner where he's blended in the singles for the really, really outstanding aesthetic that we have going here. And then coming around to the other side, it's the same story. The great thing about this patient is he had really awesome, very strong natural temple points. So it was only the temples themselves that need to be filled in and blended in with that forelock. Again, single hair grafts, nice density, and he continues to comb through it because he really wants you to see all the detail on this patient. So I love these kinds of presentations. I love these kinds of results. fantastic outcome, good job. Got another FUE case, 2,000 grafts, give or take, Caucasian patient, repair patient. He had a strip surgery sometime before he came to see Dr. Sean, and you can see that there wasn't a lot of hair there, not a lot of growth. Don't know the full backstory, but roughly 2,000 grafts via FUE 1.5 years later, and I really wanted to show this result because this is the kind of result that I think is realistic for a lot of people out there that have advanced hair loss. He was about a Norwood 5A, and it shows that you don't need a lot of hair to repair previously bad work, but also to achieve a natural appearance. This reminds me of my own case. With my own surgery, first surgery, repair case, I had 2,400 grafts. It's a similar type of approach because it's just dealing with the front half of the scalp, and the priority is to create a natural outcome to where it's a high hairline. He may still be really thin in the back, but it doesn't look like he's had a hair transplant. Nice singles in the front, good, believable, natural looking density. And as you can see here where he's talking, I turned down the audio because I don't want to have that kind of thing influence your visual opinion of the outcome. I'm trying to be objective with this, but you can see that it really works well for his face. He seems to be happy with it, which is great, of course. But these kinds of results and this kind of documentation, I think, gives you more of a realistic idea of how these kinds of results can turn out. So great job from the doctor, and I'm really happy for the patient. So okay, next up we have a case of afro hair, 1,932 grafts via FUE, only 7 months post-op. And we can see the before images here, Dr. Behnam showing the temple recession. You can see the surgical plan where the outline is going to be indicating the new hairline will be. But then we also have the grafts from the surgery. You can see that through FUE, they came out looking good. You got a nice curvature that is inherent with afro hair. That's why it's usually a challenge. But then only 7 months later, you can see the growth is fantastic. And we have a beautiful wave that's going from the native hair into the recipient area with the transplanted hair, indicating that all those grafts were placed at the proper angle, the proper direction, so that they do blend with the native hair. All the angles look fantastic. And then what we also get is we get the comb through on video, just like, you know, Dr. Behnam is very consistent with this. I love the fact that he's doing this with all of his patients and documenting how the hair looks through, you know, with a comb through, and making sure that you see what you get with close scrutiny of results. And remember, this is only 7 months post-op, so the density is going to improve. The texture of the hair is also going to improve. Not that it needs it, because it does look like it's blending very nicely with the native hair, but you really can't beat this kind of result, especially at 7 months for FUE on an afro-haired patient. This is a great outcome, and I'm looking forward to seeing the actual final outcome in another 5 to 7 months.